Hello everyone, this is a video about testing for chronic Lyme disease, also known as persistent borreliosis. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And also, nothing I'm saying in today's video should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So somebody posted this multi-part question on one of my other videos, and it says, if antibiotics are held for some weeks, then given an antibiotic challenge, the PCR is more likely to be positive. So PCR testing being DNA testing. This was a comment or question on a video where I was talking about testing for Lyme, so that's implying the context there that we're talking about Lyme here. And it says, what about a blood culture off antibiotics? How good would this be? And then just basically saying, too bad we can't just do a biopsy and do, use those results. So fair enough. It's I guess, quote unquote, nice in some cases when you can just do a biopsy and get a sense of what's going on. But by golly, those little spirochetes, they're just all over the place in the body, and good luck getting lucky enough to stick a needle in some random spot and haul out some spirochetes. The Lyme bacteria, even though it's a very problematic microbe, to my understanding, it has quite a slow replication time. So even though it can really wreak a lot of havoc in a person's body, it doesn't really do it through like a massive numbers game the way that certain other critters might in the body. There's still lots of them, but just compared to other microorganisms, not as many numbers wise to my understanding. So the gist of the question here, I think, is asking whether or not being off of antibiotics or maybe off of other antimicrobial agents would have some impact on the sensitivity of Lyme testing. So I'll just kind of speak to that in general, because it's a little bit of a niche question, but I think it's a good point to bring up, because one of the things that I think a lot of folks aren't aware of, and quite frankly, I'm not sure that all healthcare providers are aware of this. When a person's on antibiotics for known or presumed Lyme, that does have an impact on the integrity, or the accuracy, I should say, of the standard antibody testing that's done to assess for Lyme. So what I've seen happen in a number of cases over time is, a patient gets a tick bite, they maybe another bug, but oftentimes a tick. So they'll get a tick bite, they get the bullseye rash, they go to the walk-in clinic or manage to get in to see their medical doctor, like their family doctor, nice and efficiently, which is rare these days because our healthcare system is really, really very busy, very overwhelmed here in Canada. But they are put on antibiotic, and the doc might say, yeah, we'll run some labs on you, eventually, but like just get on the antibiotics because we need to treat this ASAP, and that is the right decision. That is the in line with the standard guidelines of you treat first, kind of ask questions later, because if it is Lyme, you really want to get on the treatment ASAP. However, if a person then goes on to say get some blood work done, a week or 2 or 3 later, if they've already been on antibiotics, there's a good chance that those antibiotics will actually push them into what they call seronegativity, also known as, it'll just basically kind of not neutralize, but sort of make the antibody detection, make the antibodies undetectable after a certain period of time, or sorry, within that, after being on the antibiotics. So we can essentially kind of get this false negative in a sense, where it's like, oh, you had classic symptoms of Lyme, or you had the bullseye rash, which is 100% diagnostic for Lyme. You were put on the treatment, you felt better from that, but now your blood tests are coming back negative for Lyme. Does that mean you didn't have the Lyme? No, it just means that you probably did have the Lyme, especially if there's a bullseye rash, because that is 100% diagnostic for Lyme. Only Lyme disease can cause that. But the being on the antibiotics actually kind of made it so that the antibodies could not be detected, or that there was maybe a different type of immune system response, maybe a T cell response or something else that was happening, where basically the patient is seronegative, those antibodies are undetectable. So that's kind of the relevance, I think, of the kind of the subtext of this question, that being on antibiotics can have an impact on lab results. If a person, and I think it's suggested here in the question, if a person has been on antibiotics, or sorry, if the person has not been on antibiotics for a little while, and then they go on antibiotics for a bit and then have a blood collection, have a PCR test, is that the person saying it's more likely that test is going to be positive? Clinically, I think that's true. There does seem to be, I've seen in my practice, I believe, notable benefit to doing what they call a provocation, where you go on antimicrobials, whether it's antibiotics or herbs or what have you, to kind of start treating for the infection and then do the lab test if we're talking about more of a chronic case. Everything I said about the seronegativity from antibiotics and all that, all the research that's been done on that, to my understanding, it has been done in just kind of your standard kind of early days, like stereotypical Lyme disease kind of thing, like patients who have textbook symptoms of Lyme. They're in these studies, they would have been afflicted with the Lyme within, say, 1 to 3, but it would have been within, the studies would have been done within 1 to 3 months of that infection occurring in the first place. So we're not talking about folks with persistent borreliosis that's been kicking around for years on end, decades on end. The playing field's likely going to be quite a bit different for those folks. So in those folks, if they were to say go to get a blood PCR test for Lyme, which has generally a very low sensitivity, it's only got about a 15% detection rate, if to my understanding, just based on the research literature that I've seen. If you do a provocation, clinically, I wouldn't be surprised if we saw an increase in the sensitivity of that test's ability to pick up the presence of the Lyme. I really rarely run requisition blood PCR testing, because the sensitivity is so low. And yes, by doing antimicrobials, it probably does increase the sensitivity of the test. I think, in my opinion, there are other tests. I personally really like T-cell mediated testing, or ELISpot testing as it's called. I think that's a more useful test. I think it's a more reliable test, fewer false negatives in my experience and to my understanding, than the PCR. But I think that it would make sense, based on what I've seen clinically, that the test would be more accurate if there was an antibiotic challenge or an herbal antimicrobial challenge. Where the question is also asking about a blood culture, so would antibiotics have an impact on that? So a blood culture, to my understanding, really is the gold standard test. You take the blood from the patient, you grow it on a culture medium. It's this very specific culture medium called, I think it's TSK or JSK or something. I can't remember now. Been a while since I looked at those notes, but they basically have to grow the Borrelia, culture the blood for anywhere from 2 to 4 weeks before they can actually generate enough Borrelia on the culture medium so that they can start seeing them under a microscope, special type of microscope called a dark field microscope, which I have one behind my shoulder on the desk behind me there, used for different purposes, not for diagnosing Lyme, because it's really hard to do that. It takes, you have to have a full lab set up, you have to have incubation equipment and all of that, and it's just really tough to culture Borrelia from a blood culture. Now, would antibiotic treatment be good for that? Well, if the Borrelia is hiding out outside of the blood, then yes, I would say it would very likely increase the accuracy of a blood culture if one was to go on antibiotics or some other strong antimicrobials first, again, just to try to chase the microbes out into the open, so to speak. But again, blood culture is just not, to my understanding, I don't know of any labs that actually do it outside of a research setting, because it's just so slow and cumbersome. Just the resources required are huge. So I'm not really sure of any labs that actually offer that outside of a research setting. But it's a good question, and appreciate the question. A little bit of a niche question, as I mentioned, but hopefully the broader discussion around testing and being on antibiotics and whatnot, around testing, kind of around seronegativity, or maybe increasing the accuracy of tests, hopefully was of interest to folks beyond those interested in these more niche topics around lab testing for Lyme. So thank you for the questions. I hope this was of interest to folks. If you have any questions on this topic or anything else related to complex chronic illness, please feel free to post in the comment section below, and I will do my best to answer as soon as I can.